afternoon and welcome to PWO News. I'm Shakil Salam.
Good afternoon and welcome to PWO News. I'm Shahida Hanif. The headlines for today's news is:
Bowel cancer screening saves lives.
A major health promotion campaign has hit Lancashire. Community engagement initiative with a clinical twist.
Edge Hill University evaluation.
Lancashire Bowel Cancer Screening Programme is leading the way in engaging with communities to increase the uptake of the programme.
Well, bowel cancer is one of the commonest cancers in the UK. About 1 in 20 people will get bowel cancer. If it's picked up early, it is curable. And the whole idea of bowel cancer screening is to try and pick up the cancers at an earlier stage, such that there's evidence now that with screening you reduce the mortality from bowel cancer by about 15 to 20%.
Bowel screening is really important because by screening we can pick up precancerous conditions, or we can pick up cancers before they develop any symptoms or anything like that. So then the chance of the treatment and the outcomes is much greater.
Bowel screening program is very, very important, because through bowel screening program we can pick up so many cases which can be detected early and treated early.
Don't be a twit, do your kit.
Why aren't communities taking part in the life-saving programme? Let's see what the professionals have to say.
So those from more deprived communities, we find men are less likely to do the kit. BAME communities.
I think there's lots of different reasons why people don't do it. I think we often find that people are busy in their own lives and they've just not got around to doing it, or it goes on the side and it looks quite a complicated kit, the one that we've been using so far. So there's lots of logistical issues as to what you do with the kit, where you hide it when the grandkids are around.
Lack of awareness, fear, not wanting to know the result, it'll never happen to me attitude, fatalistic attitude, as in if it's going to happen to me, it's going to happen to me whether I do the kit or not. Competing priorities, it's not often in the forefront of everyone's mind. They've got a lot of other issues to deal with. Families not understanding it, so maybe someone with a learning disability might not understand how to do the kit or what it's all about.
Maybe because they've never received one, or it could be because they're a bit worried about handling poo or other health conditions, or it could be that they don't know how to do it.
Do the kit, stay fit.
How important is health promotion and how does it work? Has it been effective?
Well, the health promotion team have done tremendous work promoting and encouraging the uptake of the fecal occult blood test and the FIT test. Basically, when we first started in Lancashire doing screening back in 2008, the uptake was around 50%. In some areas now it's nearly over 60%, and they've been targeting low uptake areas in Lancashire, and the uptake has tremendously increased due to the hard work they've done.
Definitely important. It helps raise awareness. Definitely increases uptake. We've seen over the last couple of years a lot more people doing the kit, a lot more awareness about bowel screening. We've also had the national campaign around raising awareness about bowel cancer and alongside the bowel screening.
Any time is poo time.
Lots of lights, camera, action from the whole team.
nurses standing there. And if you got certain things on board, the man at the top get let you.
I heard about this when I was in the hairdressers, having my hair done. I got a phone number and I sent for a kit and I did it. It came back negative, thank God.
Thank you.
You're more than welcome, Mr. Bellman.
पहली दफा आपका तामन सुना है कि हर लैंग्वेज में आप बताते हैं तो इज वेरी काइंड ऑफ यू.
Who gives a crap? We do.
But the challenge for the team has always been how to prove how promotion and community engagement has been effective. Wait a minute, newsflash. A groundbreaking project has taken Lancashire by storm. It's increased the uptake and engagement. It's just coming through.
So let's go and have a look what's happening. It's community engagement with clinical twist.
The health promotion team have been targeting low uptake GP practices, going into those practices, contacting the non-responders and encouraging them to come in and talk about the fecal cord blood.
Invited into a 15-minute appointment and they attend at the surgery, the GP surgery, and they are told there's nothing to worry about and are shown the kit, asked if they've ever received a kit, and then shown how to complete the kit if they haven't ever completed a kit before.
We meet with practice managers or cancer champions, and we go and explain. So as GP and community health engagement officers, we would explain what the call for a kit clinics are all about.
I think one of the reasons that we've had a lot of success is that it's an appointment that's dedicated just to talking about the bowel screening. So it's not as though we're trying to sort of tag it on to the end of an appointment with the doctor or the practice nurse or something like that. So the patient really gets the opportunity to raise any questions or concerns that they've got. We're not there to put pressure on people or try and make them do something they don't want to do. It's about having an open and honest discussion about it, giving them some more information, and then they can make up their own mind whether it's something they want to take part in.
It's all about taking a community approach, about putting patients at ease, talking their language, using no jargon, and really just having fun with them and explaining things in their language so they can fully appreciate and make an informed choice about ordering a kit or not.
So the health promotion work that we've commissioned locally as part of the bowel cancer screening programme has been vitally important in improving uptake in the targeted communities. So where we're seeing low uptake within certain practices, within certain community groups, that work has really made an important impact and improved the uptake quite locally.
Quite often in GP practices, GPs don't have the time to spend that they want to spend with the patients. Our staff can have that time with them, talk it through in a very easy way, and get the message across so that they can understand.
Unfortunately, as a GP, we don't get extra time to explain these things to the patient. So by having a dedicated team of these people who are helping with the screening of the bowel cancer, it's really increased the number of cases who are coming forward, and we have picked a few cases of bowel cancer through that. And thankfully, all these patients, they are survived because they have the right treatment at the right time by the right people.
The amazing thing is that there's been a significant increase in non-responders taking up the test, and we picked up a few cancers this way.
Yeah, the bowel cancer screening programme, when they came to our practice, they were amazing. What our healthcare assistants learned from it and what our patients gained from it was really good, and it gave us the basis of what we could then do to actually make that really sustainable for the future. I think that face-to-face contact, that actual kind of communication with somebody rather than receiving information through the post, information online or information through radio or television. I think that direct contact that you're able to have with a non-responder, with somebody who may be questioning why they would like to take part in any of our screening programmes, I think is probably the bit that works the most. And we'd love to be able to replicate that for our other programmes and use that work that you've been doing around the bowel cancer screening programme to kind of be seen as our shining star.
In addition, the initiative, the Call for Kit kit test has been recognised both here and internationally as a very good initiative, has generated tremendous interest.
Don't let the poo hit the loo. And now we go live to Edge Hill University, where our special correspondent Shahida Hanif is there. Hello Shahida.
Thank you, Shaquille. I'm here at Edge Hill University and I'm going to be interviewing Professor Paula Day, who carried out the evaluation research for the Call for a Kit project.
Importance of the evaluation was that the team wanted to be able to say to practices what the benefits of undertaking the clinics were and what the implications were for the practices themselves, so that they'd be able to do this and give that information to practices who are a bit unsure. So we sent a survey about what practices' resources were being used to support the clinic to 10 practices across different CCGs, some of whom had done the clinic previously, some who hadn't, and we also interviewed 8 members of different practices to actually get a feel for what they perceived as the benefits, what they saw as some of the drawbacks possibly, and also so that they could give some more information of how they feel it could be improved. So the results showed that actually the team was really welcomed by everybody, and I think one overriding quote that really sort of synthesises all that was that somebody said, if they could come back again, we'd really welcome them. We showed that the team was really professional, that it didn't take up too much burden. It met this practice's expectations. It raised their awareness about having low uptake rates. It helped the practices understand what they could be doing more. It did actually have an impact, they said, on reducing the non-responders as people did go ahead and get kits. But there were other benefits as well. They felt that even patients who didn't do the kit would possibly engage in the future, and they also felt that now the practice had more information and knowledge themselves to be able to support the patients when they rang up, or to actually put more information out to try and encourage people. They did suggest that perhaps this approach might be useful for other screening programmes. The ones they mentioned were the cervix, breast and aortic aneurysm, and I think the biggest benefit they saw for the patients was in those patients who may have poor literacy and those that had language barriers. They did give some insights into what they said might improve it, particularly avoid Christmas, avoid holiday periods, and then what they did say was, and I think this is really showing how important they felt the clinics were, they did say that they would themselves help disseminate this with other practices. Although some were a bit unsure about that because it might mean they couldn't have the team back.
And the recent evaluation by Edge Hill University has shown that it is quite popular with a lot of the GP practices.
Since October 2017, it was the inception of the new team, and we've managed to recruit a fantastic team, and I'm so pleased. 2 years on, I've got the best job of announcing the results and the outcomes, really. If I was to say to you, our team collectively over the 2 years have delivered 297 clinics. In total, 8,961 non-responding patients have been engaged with. Of this, 4,608 have actually attended the clinic and we've met face to face. 2,680 have had telephone consultations with. And out of all this, and this is the staggering amount, 6,791 kits have been ordered from the Rugby Hub. Now this is anecdotal. Anecdotal evidence shows that 57% of those non-responders went off to complete a kit. Now we await further data from the hub in terms of what was the outcome of these kits that were completed. But this is an astonishing amount of figures. The amount of patients that the team has engaged with is phenomenal, and the figures are continually growing. And we haven't even completed the 2 years. It'll be November by the time the 24 months will be completed, and we've got so many clinics still booked to complete by the end of October. 6 CCGs out of our 8 CCG areas in Lancashire and South Cumbria have now over 60% coverage. Thanks to the team. Without the team, we wouldn't be here with these figures.
The best thing, I think the best bit has been the team, pulling the team together. Each one of them has had an individual skill, individual personality, put them all together within this team, and it's been an absolutely crap team, right? No. It's goodbye from me and it's goodbye from him.
Goodbye.
Oh, I didn't say goodbye. Goodbye from me and it's goodbye from him. Goodbye. So number 2, check your poo. And now it's your turn, everybody. Number 2.